Same, because if you have read about the history of Milton Erickson, that they call it the father of hypnosis, he suffered of polio. And he was in pain until he was 17 years old. He couldn't move at all. He just could blink. That's all what he could do. And what he did is just remember, start thinking, okay, he had polio, he could move when he was a child, but he remembered those moments when he could move. So when he was 17 years old, he started to remember those moments, visualize, hypnotize himself about those moments in the past where he could move, where he was free of pain. And you know that with 70 something, he was still teaching, he was traveling around the world, and the people that studied with him say that it was unbelievable. When the people saw him in the morning, he was like a dead body, he couldn't move. After 30 or 45 minutes of self-hypnosis, he was a completely different person. He was able just to move, to speak, to have a lot of energy, and his trick, according to him, is just thinking, remembering, visualizing those moments where he was okay, when he was a child. Those were the memories that he had. So it's important to use, in your case, that when you are working with clients, to use our clients' vocabulary. We are going to use that with pain control, and we are going to use with any kind of issue. So that's always important, because the person is going to feel identified with the story. We might create a story. It might not make much sense for us, because sometimes we just have to create whatever comes to our mind. But maybe it makes sense for them if we just throw 3, 4, 5 words that our client has said, and we create a kind of a story. You know that metaphors, usually, they have 4, 5, or even 10 interpretations. So we can all create those stories. We can, from his story, from his words, we can create something related to pain that can be positive. We can do a good reframe with his words. There is a problem with traditional medicine. Obviously, it doesn't fix everything. My dad has been suffering chronic pain for over 30 years. And I'm a little bit frustrated, not as frustrated as he is, because he's the person who is suffering pain. He had an accident about 32 years ago, and he is suffering dystonia. Dystonia is a kind of Parkinson, and he's in a lot of pain. He's been in many kind of doctors, and he's losing hope lately. So last week, about 10 days ago, he went to what they say the most pain control unit in Spain, where they give you the latest technology, they use the latest technology, and it was unbelievable, because the doctor saw him, and as soon as I saw him, the doctor say, well, I can see that you have Parkinson. First of all, my dad has no Parkinson, has something different. Second, the latest technologies that they have now in medicine are related with needles to eliminate or control pain. What happened? They cannot work with my dad because my dad has movement on his neck. So what the doctors say is, look, I'm sorry, but we cannot do anything with you. And that was probably one of the last options. My dad is from the old school. He's one of the people that they never talk. He's a man that probably I heard him talking probably 3 or 4 times in all of my life. I don't really know how his voice is. So for him to express, for that reason, when he heard that there was nothing else that could help him, I felt frustrated, because I know that there are more things, but it's not in his head. I know hypnotists that could help him, but he's not a person that will go to a psychologist. He wouldn't go to see a hypnotist because he doesn't believe. For that reason, it's important to have our mind open, and we are here. I think that we have our mind open. That's going to help us. I think that most of the times to have that mentality is going to help us in the long term. So what happened with him in this case? There are many cases that they have chronic pain, like my dad, and after taking pills, all kind of pills, all kind of tablets, after having done all kind of scanners, he's still having pain. There is nothing that can help him. And the doctors know that too. There is an opportunity for us to work with doctors. The doctors know that there are many cases, that there are people coming over and over in their practices. Hi Linda, how are you?
I've been around the building a few times. But
how are you?
You're doing not too bad.
Nice to see you.
Yeah, I've had a tour.
Was it nice?
Not so nice.
You can start working over here now.
A Freudian slip, I walked into uni slip. I didn't have time.
That will be a great team up.
Apologies.
That's all right.
You're probably on camera, you know.
Yeah, for breaking and entering. Go on, sorry.
Oh, okay. So we had just started, Linda, so you are grand. And there are only two solutions for pain with the traditional medicine, with following traditional medicine: tablets or pills or technology. And it doesn't cover 100% of the cases. There are many, many people that they come back every week to see their GP, their doctors, and their doctor, they don't know what to do. So in those cases is when we can do things as a hypnotherapist. It's very warm in here, isn't it?
Sorry, we close the windows. We're sitting here in a Would you trap. like to sit over here maybe? Or we
Oh,
could all-
would you like to swap seats there or something like that?
It's just there's a draft there. And you're There sitting is, in well, the they're room open. and it's a bit noisy.
Can I push the button in?
I'll open it and I'll sit beside the middleman if you want on my seat.
Before being a hypnotist, I was a property manager. I work as a property manager in a consulting group, and one of the most difficult issues to work with is the temperature in the room. There are always people with different temperatures. I remember when I was a property manager, they were always calling me, now this is too hot, this is too warm. And you didn't know what to do, checking all the air conditioning, everything is grand, so guys, you are okay, it's completely normal, you are okay. Okay, so working with pain, as I said before, pain is a message of our bodies. We have to learn to interpret it, at least to make sure that there is nothing organic with our body. For that reason, first of all, if there is any pain or you are having any pain, go to see your GP. Traditional medicine is always the first. I would recommend you even the second option. I mean, don't be happy just with one opinion from one doctor, because another doctor can tell you something different. So after a second doctor, they are telling you that they cannot find anything, go to see a hypnotist. If you are a hypnotist, just help people that are having chronic pain or acute pain. There are two types of pain. Probably most of you know what are the difference between acute pain and chronic pain. Acute pain is a tissue damage. If you burn your hand, you know that you are going to have pain maybe for 1 second, 2 seconds, 5 seconds. If you keep your hand or you suffer a burn in a fire, after 1 month, 2 months, the tissue might be recovered too. So that's acute pain, it's something specific. And chronic pain usually is the pain after visiting all the GPs in the world, after following all the technology, after, as my dad happened to him, that he cannot find any solution, then you will be considered as a chronic pain. Usually that's what happens with back pain. That's over 80% of population have problems of back pain. So we are all a little bit chronic pain sufferers. And that's good to emphasize. Thank you. Say again?
Emphasize.
No, it's not to emphasize. It's just to empathize. To empathize with our clients, because if we have a kind of feeling, we know better what they mean. So just make sure that you make that difference there, and we are going to continue. Working with pain control issues with hypnosis might last very short, or it might last a little bit longer. There are people, we will see in a moment the division of pain, how it is divided. It's not just a physical sensation. It's important to recognize that there are emotions involved in pain. Or probably the less you accept about your pain, the more pain you are going to have. For that reason, the time depends on the person in many cases, obviously, depending on our ability to help people, but the more open the person is, the more motivated the person is to change, the more convinced the person is that hypnosis can help them, the faster the effects will be. Usually after one session, someone that is in pain is going to feel a great relief. Usually the procedure works between 3 and 6 sessions, would be pain control on average. A protocol, it lasts between 3 and 6 sessions, where we will work with emotional issues, we will work probably with regression if that's something that might be causing the pain, and we will work with the pain per se, with the physical sensation. As I'm saying here, as I'm writing here, when we are working as a hypnotist, we are going to need to dip the person quite deep, depending on the issues, to maybe help our clients to achieve a somnambulistic state, especially if we want to work with analgesia or anesthesia. Anesthesia, as you know, is a complete elimination of the pain. Analgesia is just the reduction of pain. For that reason, you imagine there are people that get operations, they go to surgeries without chemical anesthesias at all, only with hypnosis. So for that reason, we have to make sure that the person, we have worked 2, 3, or 4 sessions with that client before seeing the surgery, and making sure that the person is able to achieve a deep state of hypnosis. As a minimum, to work with pain, we should achieve relaxation. Because you know that pain, when you have pain and you are tense, the pain gets worse. So minimum is relaxation. And all of us, as a hypnotist, that's the minimum we can do. Because even just by talking, you can relax a person. I can see that Pascal is showing. Now I'm relaxing him just with my voice. So that's a good example. And motivation. When we are talking about motivation, probably you have heard this word before, secondary benefit. That's very important. There are some people that are not willing to change, to eliminate the pain subconsciously. Even if they say, no, I'm fed up of this pain, I really feel very sick. They might get something positive from that pain. I don't know, just thinking, I don't know about the secondary benefit of my dad, in that case that I was saying, but what I'm thinking, this is just a personal opinion, as he doesn't like talking to anyone, he's a very introvert person, I think that he enjoys to have some pain because that's helping him to stay at home, not having to meet anyone. He doesn't like the family gatherings. So I think even if he doesn't recognize, that's just my personal opinion. Obviously, I haven't told him anything. Obviously, he's not going to see. No, maybe he speaks for the first time in his life. I don't know. He's not going to see that camera either. So, and what happened, there is a case that is quite popular about a lady, I don't know whether I read this. It was an old lady that only her family used to visit her when she was sick. What happened with her? She developed sickness, she developed pain. Subconsciously, she didn't realize, but her family was visiting her only when she was sick. So her subconscious mind saying, okay, if my family is visiting me, when I'm sick, I'm going to create a pain so my family can come to visit me. So that's what we call secondary benefit, and influences.
Sorry, with sympathy pain, he was saying, you know, when a woman's pregnant and the husband or whatever has all of the same symptoms, is that kind of secondary benefit? Is that similar?
No, that's no.
Okay. That's probably empathy. That's probably. Yes.
Well, if she's getting all the attention because she's pregnant, he'll get some attention if he's not feeling well. Because men don't make good patients.
That's true. And there is.
He gets the attention.
Well, that might happen. Yeah, that could be, in that example, that could be a secondary benefit.
Because women become pregnant to rest and people are mindful of them. You know, put your feet up and take it. Whereas he said, excuse me.
But there was a chap on TV recently and he was having morning sickness,
That's right, on the news.
breast cancer and everything, absolutely everything, the same as his wife. you know, and he really felt he was going through the whole lot. And you could see his face.
He got time off work for it. He got maternity leave for it.
And a big girl.
No, well, they did some research. There was a doctor gave an interview about it, and he said there was a history of the woman having lost several children. So he was highly anxious.
Yeah.
So
And he was
could be that
taking
he
over.
transferred his anxiety, so much so that it created a physical response.
So in that case, the woman transferred the anxiety?
He was transferring his
Because
concern
of
for
his
her.
grief.
His
maybe.
grief was so great,
Okay.
his anxiety was so great that she would not carry the next pregnancy. That
He was
it was
sharing
almost
it.
as though he was pregnant as well.
And she'd
So-
it.
Yeah.
Okay, you know, that could be a mix of everything, because now that you're telling that story, I'm thinking about the, how do you call the mirror neurons, that you behave like the person that you spend more time like. And that's because our neurons, and sometimes you know about mirroring, matching, that is unconscious. So time when you are in rapport with someone, those mirror neurons start acting. You are behaving in the same way. Why most people that they are together, they look like each other? Couples, they look like each other. Children, they get dressed probably the same. First of all, they want to be accepted in the group, but it's like subconsciously they want to be all in the group, but at the same time those neurons are working, the mirror neurons. Okay, what else? And again, there might be a fear of letting go that pain, so that's difficult. If we are working with a client that doesn't want to let it go, because what's going to happen in my life now without pain? My dad, 30 years with pain, well, now I don't know, he will fly, he's afraid of flying, so he's afraid too, probably. And again, how long is going to last the relief that we can provide for people? It's depending on the person. So obviously our skills are going to affect, but the person is so important. For that reason, something that is very, very important is the first session, our intake form, collecting information as much as we can, because that's going to give us an idea about what is the motivation of the client, probably secondary benefit too, even if we might need to do some parts therapy, we might need to do some regression, we might need to do some NLP to see if there is a secondary benefit. But with how the people are talking, we can get a lot of information. Okay, and how many of you think that can control the pain by themselves? Have you ever tried to control pain by yourself?
Yeah.
Yes.
Okay, how was your experience?
I do it on a regular basis.
Okay.
It works once I focus on it. When I focus on it, I can reduce the extent of it or the experience of it, and I can get through something. For example, if I know I have to drive somewhere, or if I know I have to sit somewhere, I will use some of the techniques to manage it. But if, for example, you go to the cinema and you go to get up after the film, you can't move, you know, because
The pain is there already.
It's there already, but when you go to move, you know, it's when it's exacerbated. So that's when you just take control of breathing then, and go with breathing.
Okay, so when
So
you...
I use breath rather than visualization at that point. But other than that, I would use visualization and breathing.
Okay, so in your case, you focus on pain and it helps you to reduce or to control it.
Yes.
Okay, thank you. Any other strategy, personal trick to control pain?
I used memory.
Memory.
Memory, yeah. I couldn't walk properly for a long time, and I used memory because I was very active when I was younger.
So you look back in time
I
as
couldn't use my hands,
Milton
my
Erickson?
legs, and I literally couldn't. So I just used memory, and I was going to the hospital, and they were going to give me morphine injections, and I refused and said I was going to use memory, and they were like, "You're crazy," you know. So now I'm.
And how are you now?
Yeah, I won't.
So it helped you.
So, yeah. So.
What caused it, do you know?
Oh, I used to restore church windows. I was St. Arthur's, and I had lead poisoning, and that caused a lot of injuries to my body. So when I was 30 years old, they told me I was going to be in a wheelchair, and I'd lost both hands were gone, my shoulder, everything. So the doctor I have now is fantastic because he recognised hypnosis. You know? That's what made me look at training.
Yeah.
Yeah, well, I think the
That's fantastic. That's a great story.
Can have a big impact as
the ones that were treating me then were dreadful,
Yeah.
but you know, the one I have now, after I got better, he's very good. He recognises hypnosis and he thinks, you know, he can see.
The
Even
benefits.
if I go to him now and I'm saying I'm using memory, he respects that, you know. But I just use, you know, Erickson's techniques or something.
If it works.
This is a great example about how hypnosis and memory can help you to control pain, and how sometimes it's needed a second opinion. So not just to be happy with the first opinion, because doctors
Well,
are
I've seen
human.
5 surgeons, you know, I have MRI scans of every part of my body, my photo album, you know, and I was seeing 5 surgeons, and no, they couldn't understand why I was so, my body was so badly damaged, you know, and they were sending me for a Dublin morphine injection, well, they want to, and, you know, I've read about Erickson and I decided to use memory, and I did the techniques that, you know, and just, when I was born, my body was perfect, so I presume I can get my body back to that.
Very good.
So that's what I
And at the moment, are you still using some techniques, or you are feeling completely pain-free?
I know occasionally I might need to use a technique, but as I said, I ran a marathon, so, you know. But the memory, I'm a great believer in limitations in our own mind, you know.
Absolutely. We all have our own techniques, and thank you for sharing that story. We all can get motivated, and it might happen to us maybe tomorrow, the day after. So we always.
People who come to me now, because I've just finished training hypnotherapy, and I'm just starting to see clients. But I think people come to me saying, "Oh, you know, like you're so active, and you know, and that." And I tell them, and they're usually, you know, but people who knew me before are surprised to see how I can walk and everything now, you know.
So that can be very inspirational for your clients too, for all of us and for your clients, and your clients can relate to you and vice versa too. So great story. So feel free to share any story from your process, from what happened to you. Okay, so the truth is that we are all using techniques to control our pain. Has any one of you got headaches? Someone? No? Okay. Has any one of you got any pain at the moment? Okay.
I a bit like you, I had an accident 2 years ago, and like you, I was in a wheelchair for a few months.
And I shoved her around.
She pushed me around in a wheelchair, and I was told
She's a very good friend.
Distorted, but I was told I would be left with permanent pain in the foot and different parts of the body. But because you use your feet for balance, because the foot has been smashed, I fell out of an attic and did a few, you know, injured myself in a few places. But because your feet balance you, if your feet aren't properly aligned, you will have secondary pain elsewhere because you're throwing your body out of kilter.
Yeah,
So what you don't start off with as an injury becomes an ongoing.
The
Yeah.
elastic bands.
Yeah,
your
exactly.
fingers.
This is it. But what I found interesting was they tell you at the start, the doctor will tell you, we can fix your foot, but we can't fix the pain. You'll be left in pain. And that's seeding a negative.
It's negative.
That's physically seeding something. And I challenged it with them, and I said, well, listen, I'll use hypnosis. Well, if it works, and you're dismissed.
Yeah, absolutely.
You know, now, it may
it's a
not
shame.
eliminate, but it makes it much more manageable for me. And there are times when I am pain-free. Do you understand? And I enjoy those times.
Yeah.
And they are kind of, I'm getting back to that. Do you know that?
Yeah.
When the day you wake up and you have a bad day, like it takes me an hour to move in the morning, you know, I defrost. But you know you can get to that thawed out position, and you plan your time, and you use your time wisely. It's like taking on time management as well.
I don't know if you've ever tried this technique. I do it just prior before I go to sleep. You know, that just where you're just about to drop into the lovely feeling. I always focus on just putting that positive and you know, just visualizing just at that couple of seconds.
Tipping off point.
And when I wake up, it always works.
Yeah.
Now, sometimes you won't do that. You'll be very tired and you end up going to sleep.
What do you visualize?
I visualize my body, you know, healthy. I see all the muscles and the bones and everything really strong, and I feel the strength in it. I remember when I was running as a child, and I used to go horse riding, all of that. I visualize that, and I can feel it. I literally can feel it. And different parts of my body, you know, because of the lead poisoning, my digestive system was all, my gut and everything was all damage and everything. So I visualise the gut in my head what it looks like, and then I see it healing, and I just keep doing it, and it works.
And especially before going to sleep and early in the morning, we are more suggestible.
Yeah.
So
Just before I go, I find it works very well. Just before you go to sleep for me, even more in the morning. When you do it in the morning.
actually, before going to sleep, probably we are in theta state.
Yeah.
That
We're
is
open to
nearly somnambulistic there. So we are
conscious
completely,
mind slows them down.
yeah. So that's very good.
But you must remember, if we go back to our childhood, what do you do if a child comes to you crying? Show me, where did you fall? Kiss it better.
Yeah,
That's the first introduction to hypnosis.
exactly.
And they will kind of, okay, I'm better. Yeah. Whereas you say, oh, that's terrible. The child says, oh, it's terrible. So.
But I read somewhere that when the doctor said to you, you always experience pain.
Yeah.
I read somewhere that you can get an operation if the nurse is talking to the surgeon
That's right.
and say, well, this patient will take a while to recover.
Yeah.
Your subconscious is like there.
Well, I worked as a theatre nurse, and I saw that loads of times because I'd be on the floors maybe in the evening time or what, and the doctors or the surgeons that were not nice about the patients, those patients wouldn't recover as quickly as the surgeons that were nice.
Yeah.
You really could see it.
Yeah.
And sometimes they'd come around and the patient would the next day say, I don't know what it is, but I feel very negative. And I mean, that surgeon, there's some surgeons and it would be horrible about the patients, but they knew they could pick it up. I just found it very interesting.
Yeah.
So could you focus on any part?
I focused on every
Say,
part.
I've been diagnosed with overactive thyroid,
Yeah.
and they tell me it'll be a year with a lot of medication.
I don't listen to them anymore.
No.
That's the one thing I do. I don't listen to them.
Yeah.
In their experience,
But you
in
have,
their experience, it's
Yeah,
here.
you have
But what's
to
your
listen.
experience?
They'll always say to you, they'll always work a worst case scenario. I find with the hospitals and the doctors. That's what. And then when you go back to them, they'll kind of go, oh, that's interesting that you managed to do that, but that'll only last for a short time. It's nearly always negative. I don't think the GP you have now is good.
But when you have all these symptoms of anxiety, racing mind, my body is doing double the work that your body will do. How would you?
You control your breathing. You focus and control your breathing. Because when you control your breathing, you slow your thinking process down. And when you slow your thinking process down, you can become rational. And you can say, this isn't me, this is my thyroid.
So do you think
This behavior, and
hypnosis could help?
Yes.
Oh, yeah.
Definitely.
You visualize it.
Definitely.
Definitely.
I would.
Lots of different visualizations you can use for your thyroid.
Definitely.
It's going to help you no
Turning
matter
it down,
what. Once you
slowing it
start
down.
doing it, you'll see improvement. How much it helps you is, I think, the same is up to you. Definitely. But what I do is another trick. I don't know whether this is. If I had, say, immense pain like that, I had calculation. And that was really bad.
I have no pain.
Well, this is what I did when I was having collation, because I'd have collation and then I'd literally be sick for a whole week and then I'd have to go back and have it again. I did that for like 7 weeks. But I would focus on something that made me really, really happy. It could be something stupid like a sitcom or
Watch a movie.
I
Watch
literally
a funny
focused,
movie.
just put all my energy into that at that time. And that seemed
There is a very simple example. If you can imagine, the suggestibility test, the convincer with the lemon candy, and you know that when you put it in your mouth, just with your imagination, you are going to start salivating. So that's an example that you can change the physiology of your body just with your mind. You start thinking about lemon, you can even smell it. And after 30 seconds, you are going to start salivating. That's a visualization, and you are modifying, you are increasing the speed of your salivation. So you can do exactly the same with the cells, with whatever you want to restore. Obviously, it takes time, it takes practice and patience, because especially self-hypnosis is not just from one day to the next day. Probably the first day you feel better, but it's very easy just to say, okay, this is not working out. So the more patient you are, the more effective it will be. But I will.
like a child, I find you have to talk to it. I found when I was going to collation, I would talk to my gut, and because it's like a child, and you kind of lead it.
25% of Irish people were put into psychiatric hospitals because of overactive.
Yeah,
thyroid.
That's
it's
awful. That is
Yeah.
awful.
Mostly adrenaline as well.
Sorry?
It's mostly adrenaline. It's often caused by adrenaline when the readings come up. They've discovered that.
Yeah.
Why would the
Because
desire
we're
use
really
that?
anxious, is it?
Is it-
Very anxious.
Yeah.
Is it because it makes you feel anxious?
Yeah, you're on the go. Your body's doing double.
Although
the
you're
work.
on speed.
Yeah, it's like I go,
Yeah.
and I would never be tired.
During crash.
And then I have
Hit
this
a wall.
major crash where I just dip down,
Yeah.
and then that'll last a day, and then I'm back
Back up
again.
again. Yeah.
Like I would be doing, you know, for my age, I should be slowing down. Instead, I'm doing a 25-year-old going.
On the upside, you can eat like you like.
Yeah, but the body.
No, but it's
sustain.
exhausting. It's exhausting.
Yeah, the body couldn't.
Yeah,
So that's
I have a
right.
friend who's
Reading
the opposite.
and visualization.
And I was
were
lucky because most people present with a heart attack, and that's how it.
My mother was diagnosed with overactive thyroid, and it was a couple of weeks beforehand. We were in, and it was though somebody had turned her up at the back. We were watching her making sandwiches, and she was like the Duracell bunny.
Yeah.
And my son actually said, "Granny, did somebody wind you up?"
Yeah.
And she said, "What's wrong?" Because her head was going too fast, and then it swung the other way as well. So I can understand what you're saying. I've seen it with my mum. You know, it was exhausting. But the breathing and the visualization and the belief that you can then control it. You are the one who controls the button or the knob. You know, the dial tone. If you believe that you have that ability, you do it.
So I wouldn't overthink it. That's what I'm like. I mean, that was my thing. I just didn't overthink it. That was it. Was getting it. And that was it. I'll walk by, you know, next month, and that was it.
Maybe later on there is one technique that is called the light switch. It's about imagining a light switch in the back of your skull that you can switch on or switch off for adrenaline or for stress or for pain. So that's one of the techniques. You can use it for people who are I use it for someone who had a chronic fatigue. So just imagine that there was a switch in the back of her skull. Whenever she was feeling down, she was just switching it on and increasing the levels of energy under hypnosis. There is something that is called the pain control room. Just imagine that there are different dimmers in your brain, and you can just increase the level of energy, decrease the level of pain, just with your imagination, creating that pain control room in your mind. You might have some information here, but everything requires practice. And even if you are a hypnotist yourself, you can help yourself, but you can let other hypnotists to help you with that. So let other people help you. Okay, so we can continue because I asked just one question. I'm not going to ask you any more questions, by the way. I'm not asking anything. Because the thing is that we all can control pain. Imagine that you had a pain now and the fire alarm went off and you start smelling the smoke. What will happen? Nobody's going to remember or think about the headache. Everyone is going to run away. If you start seeing a fire, automatically you are suppressing pain. So that's one example that you can suppress pain, you can control it. With headache, you have a headache and you break your thumb. Imagine that you break your thumb. So what are you going to focus on? You are going to focus on your thumb. Probably you are going to eliminate the pain. Subconsciously, you are going to eliminate that pain. When you go to a dentist, I don't know if they do it here in Ireland, but there are some dentists that they give you headphones and automatically they distract your mind. So you are just changing the perception of pain. Because pain, is it real or is not real? The pain doesn't exist. It's a perception. It's something like reality. This might sound, I think that we saw this when we talk about the past life regression. Life is a subjective perception. Pain is a subjective perception. So it doesn't really exist. The pain is depending on us. And we can modify, we can control it. This is, if you work with doctors or you work with GPs, they always like you use very technical stuff. And I remember I haven't been talking to doctors. One guy I was studying with, she had a meeting with a GP, and as soon as she named the gate control theory of pain, the GP just paid attention on her because she was talking in a technical way. And that's a very simple theory about how the pain works. Just imagine that under the skin there is the pain receptors that we call nociceptors. And the stimuli the sensation of the pain are transported when we receive the stimuli from those receptors through the fibers, the large or small fibers. The large fibers, they carry on non-painful information about the stimuli, and the small nerves or small fibers, they carry on painful information. When that's transported through the spinal cord, there is like a door. When the stimuli gets the spinal cord, interprets, okay, has this nerve painful information or is non-painful information? If there is more painful information, automatically the gate is open and the pain or the stimuli just go through our brain and is interpreted as pain. How can we just transform painful information into non-painful information? And all of you know already, because when you hit your head with something, with a corner, the first thing that you do subconsciously is just to scratch your head. And what you are doing there is just transforming the painful information into non-painful information. So that's what you do. For that reason you can do it, and it's the same, well, with the example that you were giving, a mom just kissing a boy. So it's just helping the boy transform that information. And this is probably the most important thing that we can see today. Before I start practicing, the components of pain. Pain is just not a physical sensation. Pain is composed by, well, the sensory pain. That's the proper pain, where you feel something in your body. That's the first part. The second one is the suffering. That is how you react to that sensory, sensation in your body. How you think about that sensation in your body. And the mental anguish is about, okay, I'm reacting to that sensory pain, I'm feeling sad, I'm feeling depressed. So it's like three components. I feel pain, automatically I watch that pain and I think, Jesus, this has to stop, I cannot deal with this. You get upset, and automatically what happens in your body is you might get depressed, you might get sad, and that's the mental anguish. So it works in a similar way like stress. Stress, you know, all of you know that stress is not about stressful events, it's about how we interpret those events. How do we look at those events? Now outside there might be a fight and I might get scared. I don't like violence at all. But someone, maybe one of you, might get excited and can start cheering up. Especially after a night out in the pub. That will be even easier. So for that reason the interpretation is different, and I might get very stressed, but it's the same event for everyone. So with pain is something similar. In that example, I might get stressed because I don't like the violence, and automatically I feel that I want to run away and I feel that my heart is beating fast. So I'm creating that with my mind. I'm not controlling. I can control that. But I'm not controlling in that case. With pain is the same. We feel the pain, the sensory pain, whether it's acute pain or it's just a throbbing sensation or like needles, whatever it is. That's the sensory pain, the needles. Whatever it is in your back, how you react, how you see, how you look at your pain is the suffering. And the consequence of that suffering is the mental anguish, that is the sadness, is the depression feelings, is the feeling down, whatever it is. For that reason, first of all, it's important to work with the suffering and the mental anguish, because yes, we can take the suffering out of the pain. We can take the suffering out of the pain. And when we take the suffering out of the pain, we feel a great difference, because the suffering is optional. So probably the sensory pain, we cannot do much about that. We will see that we can. But if we are able just to work with the suffering, we're going to feel automatic relief. So today probably we are not going to work much on the suffering because it requires a lot of intake form and to research about the past story and all that. So we are going to work with sensory pain. It's somehow related to the suffering, and we will see why. Do you understand these components of pain? Okay. So probably if you don't get anything during this session and you get these three things and this concept, the gate control theory, you are happy to talk to any doctor and to start working with any client. And now we are going to finish. So as I said before, it's not good to remove completely pain, but there are some situations where we can do it. There are some situations where we can eliminate pain. Those cases are when we want to use the elimination of pain for dental anesthesia. If we're going to see a dentist, that's temporary. For childbirth, that's okay, to help someone to eliminate the pain or to help the person to control the pain. Pre-surgery and post-surgery, surgical anesthesia, so that's okay. If we want to help someone that is allergic to chemicals to use anesthesia, we can help them to eliminate the pain. Someone with phantom limb pain. Do you know what it is, the phantom limb pain? Okay. And arthritis. Someone with arthritis, most cases, you can eliminate and remove pain because there is probably no consequences of eliminating completely with these disorders or pains or whatever you want to call it. There is more information about this in the handouts I'm giving you. You can check it out at home. Which one? Yeah, it's terminal illness. Someone that is suffering a terminal illness.
I thought that was chess.
This one? You have a great imagination. I don't know why, you must be a good subject.
Well, I would need that playing chess, definitely.
You're going to be my subject today. Okay.
But also with not only just pain, but apparently if you can, in serious burns, if you can reduce the burn damage by 7%.
And hypnosis works very well with burns, very well. Just helping the person to imagine in that cool armor, it works very well. So for that reason, sometimes it's sad when we hear doctors and GPs. It's true that they have been studying 8-10 years, but they don't know everything. We don't know more than them. But the combination of the two of us, that will be great. And I'm aiming for a world like that, maybe in the future. And little by little, there are more people that they are working together with complementary therapy.
In my experience, and I'm sorry for interrupting.
No, that's fine.
The doctors want to fix the part of you that they see broken. They're not interested in managing the consequences. Because they've done their job once they've set the bone. They believe your body's going to do the rest. And they can't manage. And because they can't fix it, they're not interested. So they transfer. So that's when the person with the pain or the burns or whatever has to take control.
Yeah.
And when you feel you're in control, you're not fearful. You may be angry.
Yeah.
So don't mix up anger with fear. Because when you're angry, you can strive towards resolving something. You can use your anger for a positive outcome. But if you're fearful, you can become paralyzed with fear and do nothing.
Yeah.
And become depressed. But I used anger as my fuel.
Well,
Anger and frustration because I was trapped in a hospital bed for a long time. I tell you, at the tipping point, I saw a lovely sunrise one morning. And I have a picture of it, and my wheelchair was there, the Zimmer frame to hold that. And I didn't realise what I captured in the picture till afterwards. And I said, one day I will be walking out and sitting, looking, waiting for that sunrise. And that was my goal. Do you know what I mean? But you need something. But if you don't set yourself a target.
And it's very easy to get depressed and after visiting the doctors and all that. So having that positive attitude is going to help.
It's hard to get to that point.
Very hard. And especially when you don't have the support that you're supposed to have. So for that reason, if it happens to us, always looking for help is the wisest thing that we can do. Just to help others, to ask for help. Okay, so we're going to start practicing. And well, we can see here pain prevention versus pain removal. There are some techniques. We have 4 techniques for pain removal that we might use maybe in these cases, and there are 4 techniques for pain prevention. And okay. Just as a general rule, when you have your first session with your client, always ask a lot of questions, get the referral from the GP, from the doctor, make sure that there is nothing organic, make sure that you can help the person, get a lot of questions about the history, about the feelings of the person, about the past, and something really important, to describe the pain. We are going to work with pain as an object in most cases.
Somebody came to you and they're going, oh, I have this pain, but you know, it's never going to go away, or you know, I really don't do anything about it because it's just there, you know, like, but they want you to fix it for them as such, you know, hypnosis, self-hypnosis, but if they come and go, like if somebody comes to you to give up smoking, and they're just there because their wife sent them or something, you know it's not going to work, you know. Is it the same with pain? If somebody comes and goes,
Unless they want to surrender.
yeah, is there...
Okay, there might be cases that someone with the moral very low might be helped. But usually the more you believe, the easier it's going to help. Part of our job is to help person to get hope, because some people have lost hope. So I remember, I think that it was 2 or 3 weeks ago, someone with tinnitus, you know, is that ringing in the ear, he had lost completely his hope. And after one session, he called me, look, I've not seen any change here. I told him, look, well, it's the first session, you want the things go very fast. You know that it might take some time, you have been 4 or 5 years with this problem, it's completely up to you. If I have someone to refer you out, I will do it, but I don't know people that are specialized. In Ireland, there aren't people. So after I pay attention what the person say, and he has read a book called Turning the Volume Down from Kevin Hogan. So what I did, I bought that book and just read that book. Okay, so if this person is talking about this book, in 3 hours I was like a machine reading the book because I wanted this person to work with this person. So that person had a belief that what that book was right, what I was doing was wrong. So automatically I mix my strategies with those people's strategies, with those books' strategy. And after the second session, I asked, how are you after the session? Is this what you expected? And he smiled and he said, well, Ivan, you are giving me some hope, at least. For me that was amazing, to give someone hope. As I say, I would love my dad to have some hope, you know. And that's the thing, probably we can help our clients, even if they are feeling very down, just to increase that level of motivation, of that hope. That's the minimum, just to have some hope. If they don't have hope and they are there just to sleep siesta, or to sleep a nap, I will tell, look, don't spend your money here, go home, I'm sorry, the misery is optional, so just take your misery to your house. I'm not going to tell them like that, but I probably will tell them the truth, look, it's important that you believe that this might work, because it's for your own benefit. So that might affect how the person is going to approach the therapy in the results. It's going, even if we can reframe, we can do many things, but that's going to affect. Okay, guys, so are you ready to start practicing? I know that you are scared, all of you. It's like, what the hell are we going to do? So as I was saying before, in that first interview, a part of the history of our clients, we want to know what are the feelings of the pain, how it looks like, because the pain can be an object. We have to make the person draws how the pain looks like, because if we achieve the person does that, we're going to be able to help them to modify the sensations, the perception of pain. So we're going to work with pain as an object, helping them to create the color. We need to know the color, to know what is the shape of the pain. You know, as I was saying about the stress, anxiety, if any of you have had anxiety or stress, and you have felt that sensation. Sometimes if I have many things to do, I might feel on my left hand side from my hair to my neck, it's like something like this size. So that will be my pain that I would like to work on today, that feeling. Probably you can think of something similar in a stressful situation. Where is in your body? Where do you feel in your body your pain? Where do you feel in your body your stress, your anxiety? How is it? How is the texture? Is it soft? Is it hard? Is it solid? Is it transparent? Is it colorful? Is it all those kind of things? And
Or heavier, light.
heavier, lighter, whatever. As much information as possible, because we're going to help the person just to modify that perception. And we're going to do